Hello everyone. An important aspect within health systems management is quality of care, which we will discuss in this session. What do we mean by quality of care? Well, this definition is from the World Health Organization. It's the extent to which healthcare services provided to individuals and patient populations improve desired health outcomes. In order to achieve this, healthcare must be safe, effective, timely, efficient, equitable, and people-centered. What do we mean by the concept of quality assurance? And this is from Brown et al. Quality assurance is that set of activities that are carried out to set standards and to monitor and improve performance so that the care provided is as safe and effective as possible. As you would gather from the previous slide, quality is quite a broad concept and it includes a number of dimensions. So it goes beyond just patient satisfaction or safety. It includes various dimensions. Let's look at the first one, access to services, and this relates to barriers such as long distances to health facilities, the actual cost of healthcare, language barriers, etc. Technical competence, here we think of the skills and knowledge of healthcare providers as well as their actual performance. Further dimension of quality is effectiveness. Then an important one is safety. So the minimization of adverse events such as hospital-acquired infections. Moving on to further dimensions of quality, we then talk about efficiency, which is, as previously discussed in this module, achieving the greatest benefit within the available resources. Thereafter, we need to consider interpersonal relations. That's various interactions between healthcare providers and clients, between the healthcare team and the community, and between managers and healthcare providers. Then we look at continuity of care. This is the provision of care without interruption or unnecessary repetition of assessment and treatment. And lastly, amenities. And this is normally issues that you would come across when you look at client satisfaction surveys. Things like the appearance of the facility, comfort and cleanliness, and issues such as whether there's privacy afforded. Okay, so that's just a very brief summary of the dimensions of quality. Please look at Brown et al. For further details. There are various tenets or principles of quality assurance. So the first one is that it's orientated towards the needs and expectations of clients and the community. The focus is very much on systems and processes and the use of data to analyze processes. And it encourages a team approach in solving problems and improving quality. Okay, so we now move on to discussing the steps in the quality assurance cycle. I've listed the steps for you, and obviously in most things we start off with planning. Then you set standards, which we'll discuss in more detail. You communicate standards. You then monitor to see if those standards are being achieved. You identify and prioritize opportunities for improvement, which would then look at what the problem is, defining the problem, deciding who will work on the problem, analyze and study the problem. You then decide on what solution you're going to use, and then you implement the solution, and then obviously your cycle starts over again. Let's now talk about standards in a bit more detail. Well, what are standards? It's a statement of the quality that is expected. So it's the level of quality of various aspects of healthcare against which you measure your performance. And there's usually a minimum level set, which is the level at which you can ensure safety. It's also important that you have set standards that are achievable. There are standards that would be context specific, local, and there are standards that would be international standards that need to be met. So what are the advantages of using standards? Well, it's a measure against which one can assess performance. You can then follow up over time to show a demonstrable improvement. You can reduce unacceptable variations between different facilities, amongst the same facilities over time. You can help, by having standards, help the public know what to expect. And if you then do measure standards, you can ensure compliance. Okay. So standards might be part of regulations, policy, legislation. In South Africa, we have something called norms and standards regulations, which covers various aspects of quality of care. In this document, we have user rights, clinical governance and clinical care, clinical support services, facilities and infrastructure, governance and human resources. I encourage the South African students to take a look at these norms and standards regulations, and students from outside of South Africa to see if there's an equivalent set of regulations for their country. We mentioned in an earlier slide that once your standards have been set and communicated, you then move on to monitoring those standards as part of the quality assurance cycle. And the question is then, how do you monitor it? Well, you could do inspections of health facilities, and those could be internal inspections by the management of the health facility themselves or from the departments of health, or you could have an external body do inspections. And in South Africa, we have a body called the Office of Health Standards Compliance, who inspect health facilities in the country. And they have various inspection tools that they use for different levels of care, and it's also divided into functional areas. So, there might be a tool for your medical and surgical wards, for your human resources department, etc. And then there are different methods of data collection. These would include document review, patient record review, staff interviews, patient interviews, and observations. So let's look at some of those data collection methods during inspections. This slide shows a review of various documents, including minutes of meetings, standard operating procedures, health information data, and patient registry. We can also review patient records, such as their patient notes, forms that have been completed for a patient, as well as charts. Observations can be made of various parts of the hospital, including the wards, obviously. Here we see patients sleeping on floors in one of the wards. We can look at the bathrooms, as well as areas around buildings. Here you see what looks like blood outside one of the entrances. And observations can also extend to storage facilities, as well as issues around healthcare waste, as an example here. Okay, thank you for your attention, and we will end this session here.